Thank you for joining us. Today is May 14th, 2020. We have our COVID-19 press conference. Starting today is Dr. Dart with the Tulsa Health Department.
Thank you, Richard, and good afternoon, everyone. Today, there were reported an additional 9 people who have tested positive for COVID-19 in Tulsa County, for a cumulative total of 743 people who have had COVID-19 infections. On March 12th, we announced that the very first Tulsa County resident who contracted COVID-19 while overseas had recovered. Since then, 588 Tulsa County residents with COVID-19 have recovered. Tragically, we have lost a total of 37 community members to this virus. And that death rate puts us at about 4.98% here in Tulsa County. It's important that we follow the data, which we have done throughout this entire response. And we are committed to a data-driven approach in response to this novel virus. I'm happy to report that we have seen declining case numbers since April 30th, when we reported a high of 45 cases in a single day. That is now officially out of the 2-week retrospective window that we look at. We have been fortunate to only have 14 cases in double digits 8 of the last 14 days. On Thursday of last week, I told you that our trends in Tulsa County were still increasing, but that trend was not very steep. On Friday of last week, our case trend was flat, and then over the weekend, we actually started a downward trend. That downward trend has continued throughout this week, which we're very happy to see. We look at overall case trends as well as 4- and 7-day rolling averages when we look at our data. We use the rolling averages because they mitigate the drops we see over the weekend due to limited testing and lab activity. It also gives us an idea of what trends that we might not see if we just looked at cases simply. So here in Tulsa County, hospitalization are also trending downward, which is an important metric. We always want to look at that. And Tulsans, we're actually very proud of our county and our community. Tulsans answered the call to stay home, and thanks to them, we are in a position to begin moving into our next phase. Thank you to those who have continued following the recommendation to social distance, to wear cloth face mask covers in public settings, and increasing hand washing. You are doing this not just for your own health, but for everyone you know and love, as well as those you don't. Right now, these steps are emphasized on social media as acts of heroism, and they truly are. This pandemic has provided an opportunity to appreciate our common vulnerability and recognize the important role we play in working together to face a disease that poses a significant threat to our neighbors. We need to support every person's efforts to live and take on that responsibility. As we move into the next stage of reopening, we will do so with updated guidance to help qualifying businesses make modifications needed to lower the risk of exposure of COVID-19 to customers, workers, staff. This includes bars, weddings, and funerals. It's crucial that people continue to follow social distancing guidelines to avoid another surge to our hospital systems. Social distancing remains our best defense against COVID-19. Please stay at least 6 feet from others who do not reside in your home when you're out in public. For those who are older or who have underlying health conditions, our recommendations continue to be stay home as much as possible until the spread of the virus is significantly reduced. However, if you are in need of medical care, please seek medical attention. If you have symptoms of COVID-19, such as fever, cough, and shortness of breath, call your healthcare provider to discuss testing and symptom management. Do not go to the emergency room unless you have a true medical emergency. If you have to call 911, tell the operator about your symptoms so that responders can take the appropriate precautions. If you are sick with other symptoms, please call your healthcare provider or to discuss a treatment plan. Don't wait too long to call your doctor's office if you are ill. We don't want anybody getting sicker. As a reminder, when we say stay home when you are sick, we mean if your symptoms are manageable at home, please stay home until it's been 10 days since your symptoms began and all of the symptoms have improved, or you're 72 hours fever-free without the use of medicine that reduces fever, whichever is longer. If your symptoms are worsening, call your doctor's office. We want to make sure that we message everyone to seek care and seek medical care when you need it. Don't be brave, don't be a hero, and not talk to your physician. THC continues testing by appointment only. Upon learning that the state contracted lab we were utilizing was backed up, the Tulsa Health Department immediately partnered with a private lab to send our specimens to for testing. If you would like to be tested for COVID-19 or have questions about COVID-19 in general, please call us at 918-582-9355. And additionally, we will test anyone who wants and needs to be tested. The Oklahoma State Department of Health identified 32 licensed long-term care facilities in Tulsa County to be tested for COVID-19. There are 18 facilities so far in process of testing for all staff and residents by our long-term care facilities task force. And, let's give people some context. Let's talk about numbers. Our phone bank operators surpassed 11,000 calls received since phone bank operations began on March 9th. The phone bank is staffed by THC public health professionals and Oklahoma Medical Reserve Corps volunteers. Calls range from individuals concerned about the risk of exposure, questions about symptoms, scheduling an appointment for COVID-19 specimen collection, testing, and also for seeking guidance for reopening their businesses, and just general questions about the disease itself. Some calls can last as long as 45 minutes as our operators take the time to answer questions and speak to concerned residents. As always, we're here for you. If you have questions about COVID, again, call 918-582-9355. Additionally, we work collaboratively with our hospital and healthcare systems to test Tulsa County residents. To date, the Tulsa Health Department has collected 1,858 specimens at our drive-through locations for testing since March. Cumulatively, over the past month, there have been over 13,000 specimens collected for testing in Tulsa County from community testing, medical systems, and long-term care facilities. We are committed to transparency and providing data to our residents and community partners so they can make informed decisions and be able to protect themselves. We have been transparent about our case numbers since the announcement of our very first positive in early March. We have been then, and we will continue doing that throughout this response. Our data team updates our COVID-19 data dashboard every day, and that also includes weekends. The dashboard displays counts of Tulsa County cases that are positive and reports on deaths due to COVID-19. We also display total numbers of active confirmed cases and several breakdowns of that number, including the exposure type, the demographic of cases, and numbers around hospitalizations. We also display the number of recoveries in our community, which is everyone wants to see. And you can view this on our website at www.tulsa-health.org/COVID-19. Contact tracing has remained a central focus in our response efforts. Any Tulsa County resident who tests positive for COVID-19 will be contacted by a Tulsa Health Department representative who will begin contact tracing to determine other individuals who may be at risk of exposure. Those individuals or settings will then be notified if they're at risk of exposure. A public health representative will advise those individuals and or settings of recommendations, which may include quarantine and isolation and monitoring of symptoms. If you receive a call from the Tulsa Health Department identifying you as someone who's been exposed to COVID-19, it's important that we work together and follow the guidelines given to you by the public health professional. This is an additional measure to protect you and those around you. As we enter phase 2 of reopening, the weather's warming up. Lots of us feel like we're going stir crazy after sheltering at home for so long. And we understand, we recognize that. We're eager for social gatherings and celebrations to begin again. And while phase 2 permits more people to gather, it's important for everyone to bear in mind their responsibility to limit spread. This virus is still here. We have to continue following guidelines to keep us safe, our families safe, and our neighborhoods and communities safe. Again, I really want to thank those who are practicing social distancing, wearing cloth face mask coverings in public settings, and have increased their hand washing and hygiene. It may seem like it hasn't been working, but the data is clear it is working as our hospitalizations decline and our daily case counts start to trend downward. I want to thank the community for the kind words of support to my team at the Tulsa Health Department and to me personally during this pandemic response. Our team has received numerous lunches and donations from community partners and kind words from residents, and we really appreciate your support. It helps us do our work. It helps us in this 75th day of response, knowing that everyone supports and appreciates what we do. Many health departments employees have been working nonstop on this response since the very beginning. We're grateful for the kind gestures shown to them, and trust me, they do not go unnoticed. I also want to thank Mayor Bynum, Commissioner Keith, all of our local municipal leaders who are working hard with city and county offices, Tulsa businesses, the essential work services during these phase movements to protect residents of our community have stepped up and have done a tremendous job, and which is why we're happy to say that our cases are right now on a decline. We will continue to follow the data. As with everything else with COVID-19, things change rapidly. If that changes, we'll be the first to let you know. So thank you for your patience. Thank you for your due diligence. Thank you for being a part of this response in your own way. I'd like to turn now over to Mayor Bynum.
Thank you, Dr. Dart. Please stand by. Mayor G.T. Bynum, City of Tulsa.
Thank you very much, Dr. Dart. And I think I speak for all Tulsans when I say how much we appreciate the work that you and your team have done over the last 2 months. It's working around the clock, 7 days a week in a remarkably transparent way, every step of the way through this. And so we're so thankful to have Tulsa Health Department with local independent expertise here to keep people safe. As Dr. Dart mentioned, we've had a really important couple of weeks here in Tulsa. Many of you will recall my frustration that Tulsa County was going to go ahead and enter into, at least we were in the city of Tulsa, and our colleagues in neighboring cities would enter into phase 1 of the state's reopening plan at the same time that our cases, our positive cases, were trending upwards. We did not meet the White House gating criteria at the time, but the state did overall. And so we proceeded accordingly. The good news as we approach phase 2 tomorrow is that we do meet the criteria this time. And all week long, we have maintained that 14-day downward trajectory. And I think it's remarkable when you consider that we've maintained that kind of downward trajectory at a time when social distancing regulations have been eased in our community. It's a real testament to everyday Tulsans and responsible business owners going about their way in a safe way, identifying those things that we each can do to go about our lives, but go about them in a safe way. And so I really want to thank everyone in Tulsa and the business owners who over the last 2 weeks have reopened their businesses, but done so with safeguards in place to protect their employees and their customers. The data is bearing out the success of the work that you've done so far. And as Dr. Dart mentioned, we will just continue to monitor that data every day as we go along. But so far, in the first 2 weeks of reopening here in Tulsa, it has been a very smooth and positive path for us. So we will start phase 2 of our reopening plan tomorrow. Phase 2 is really not nearly as big a step as phase 1 was. The state of Oklahoma's plan was a little bit more aggressive in phase 1 than the federal guidelines are. And because of that, we had a lot more businesses opening up in phase 1 than you might normally have seen under the White House guidelines. The good news of that, though, is that we have 2 weeks of that experience to look back and see what worked and where the challenges were. And now, as we step into phase 2, the main differences that Tulsans will see under phase 2 is that bars will be allowed to open with reduced occupancy within the bar. And then also we'll be raising our social gathering limit from 10 people to 50. And that is in accordance with the White House guidelines for phase 2 in the city. Beyond that, you won't see a whole lot different from phase 1 in our community. We still want vulnerable individuals to stay at home. This will really give us another 2 weeks of seeing how Tulsa and Oklahoma navigate this reduction in overall regulations and how individuals can handle it and maintain safety in our community. And so we'll begin that tomorrow, and that will, I signed the executive order this morning for that to go into effect tomorrow, and it will run through the end of this month, at which time we'll reevaluate how things are doing. We'll visit with the governor and his team about how things are looking around the state. We'll visit with Mayor Holt over in Oklahoma City. We'll make a decision on what phase 3 looks like, both from a statewide standpoint, which I imagine the governor will probably talk about later this afternoon, but also what it looks like for us here in Tulsa. I've had a lot of questions about special events over the last couple of days. Of course, we continue to work with the Tulsa Health Department and follow federal guidelines about special events. Under phase 2, any special event of 50 people or less will be considered. At the end of phase 2, we'll start to consider what special events might look like moving forward. I've had some folks ask me in particular about farmers markets. The one application that I've seen for a farmer's market to date would have 3,000 people congregating in a specific area over a period of a couple hours. And based on all the guidance that I've received to date from local and federal officials, that is not the type of safe event that we would want in this early going as we're trying to identify what a safe path forward is for our community. So let's get through the next couple of weeks, see how we do under this these new guidelines that different businesses and individuals are following, see if the positive trends continue. And then at the end of this month, I think we can evaluate what phase 3 looks like. I've talked a lot just now about positive trajectory on cases. I think even more important than that, though, is how our hospital systems are doing locally. I visited with the leaders of our hospital systems yesterday. We continue to see a downward trajectory, really going back to early April, and it continues downward for each of our major hospital systems here in Tulsa. And in addition to that, just this week, the U.S. Army Corps of Engineers completed construction of 3 floors at OSU Medical Center in downtown Tulsa that are solely dedicated to COVID patients. So we have now even more capacity to treat patients for COVID-19 in our healthcare system. And that, as you all will recall, was the main goal of trying to flatten the curve, is making sure that our healthcare system was not overwhelmed. And we've done a lot, they've done a lot to build up that capacity over the last 2 months. A couple other things. One, for those of you who watch these on Facebook, you may notice after the fact that there are translations that are provided on the City of Tulsa's Facebook page. The reality is we have estimated about 60,000 Spanish speaking residents in the area and about 10,000 Zomi and Burmese speaking residents. And going back to the flood last year, we asked volunteers to step forward who could translate these briefings so that we could reach more people in our community. And so those translations, after we're done with each of these, those volunteers step up, they translate the entirety of these press briefings and then put those on Facebook. And to date, for this pandemic event, those viewings on our Facebook page at the City of Tulsa have over 1 million views. So I really want to thank those volunteers who are helping us reach more people in our community to keep them safe. I also want to thank our communications department at the City of Tulsa, who developed this idea during the flood last year and put it into practice for this pandemic event as well. Very good news for us at the City of Tulsa. We recognize that as we move forward and we try to safely re-engage our economy, one of the keys, and anybody you hear talk about the key steps for a community in reopening or a state in reopening, is testing capacity. And I'm very excited to announce that the City of Tulsa is joining the state of Oregon, Washington, D.C., City of Boston, City of Detroit, Los Angeles, City of Miami, and a number of other cities around the country in a program that's being initiated and funded by the Rockefeller Foundation to expand and improve testing capacity in cities. And so the City of Tulsa and the Tulsa Health Department will be working with this new network to make sure that we have best-in-class testing here in Tulsa, and we're able to share best practices with our colleagues around the country. So I really want to thank the Rockefeller Foundation for inviting the City of Tulsa to participate in that, and it will help us with our testing programs here in Tulsa, which will help keep our city safer. The municipal courts for the City of Tulsa will reopen on Monday at 8 a.m. If you're a visitor, you have to wear a cloth face mask when you're inside the courthouse. If you don't have one, one will be provided for you. But those will be reopened on Monday. I also want to, we were just talking before this started about all of our graduating seniors in Tulsa. And I want to give a special shout out to them. They've worked so hard through both high school and college, many of them in graduate school and technical schools to get to this month for graduation. And then they're having to do their celebrations virtually. I hope they know how proud this whole city is of their hard work and how excited we are for the road ahead that is before them because of the hard work that they've put in school to build better lives for themselves and for our community. Speaking of schools, I also really want to thank Tulsa Public Schools for the program that they initiated during this pandemic to make sure that kids that go to TPS are not without food that they're reliant on during the school year. To date, just during this pandemic, Tulsa Public Schools have provided nearly 1 million breakfast and lunch meals for students. And the good news is beyond that, which is amazing, is that even though school is wrapping up this week, there will not be an interruption in meals for Tulsa children. And anyone that is interested in further details on that, you can go to tulsaschools.org/meal sites to find out where those are distributed and when. So I really want to thank Dr. Gist and her whole team there that, as always, keep the welfare of Tulsa kids in the forefront of their minds as they're going about their daily jobs. Even when we're not allowed to be in a classroom, they are still finding ways to help kids all across our community and doing so in a remarkable way. So lastly, I want to again, as Dr. Dart said, thank all the Tulsans who are just doing it the right way, regardless of people telling you that you have to do it or not. Tulsans are just doing it the right way. And of course, there are exceptions to that, but by and large, what the data is showing us is that our trends are headed down. Our hospitals remain largely on the low end of hospitalizations, and that is because Tulsans are taking steps to take care of one another and being cautious and safe. And so, as the mayor of Tulsa, I just want to thank you all so much for setting a great example for others in our community and really for our country overall. Now I'd like to turn it over to Commissioner Karen Keith.
Thank you, Mayor Bynum. Please stand by. Tulsa County Commissioner Karen Keith.
Well, thank you, Mayor, and thank you, Dr. Dart. You guys are so much the reason that things have improved in our community and things are looking as good as they are. So I just so appreciate your leadership on this. On behalf of my fellow county commissioners, I want to lay out what's happening with the CARES Act funding. As one of the first counties in Oklahoma to receive the CARES funding, we're creating the process as we go. And we have a talented team dedicated to assessing and gathering all the requests and information to be reviewed before final approval from the Board of County Commissioners. Tulsa County municipalities have begun to request assistance after county leadership reached out to them to let them know that we were here to help. As small businesses continue to reopen, many have identified needs that could be met with this funding. Nonprofits have worked overtime to meet the extraordinary demands during this pandemic, and their budgets are stretched. This fund can assist their bottom lines. There's no doubt that there's a lot of hardship in our community, and we want to do the best we can to evaluate the issues and with the guidance of experts to help us assess the small business and nonprofit needs. Rose Washington and the Tulsa Economic Development Corp is uniquely situated to assist in those efforts. So currently the BOCC has a weekly agenda item to approve funding requests, and we'll continue to follow this process unless an extraordinary circumstance presents itself that would require a special meeting. I also want to mention that with the leadership of Michael Willis, the county clerk, his office is preparing a COVID-19 checkbook that will be available on our website as part of the Tulsa County Transparency Initiative. This checkbook will list all expenditures and reimbursements distributed from the CARES Act funding. We want to be transparent and open when it comes to how this funding is spent, and this is just one way we can make the information easily accessible to everyone. Now I'm going to shift gears a little to focus on the reopening of district courts on Monday. Judge LaFortune will go into the details shortly. Before he does, I want to mention a few updates related to this effort. First, under the leadership of Commissioner Salee and in partnership with the district courts and the Sheriff's Department, the BOCC announced yesterday several new requirements and procedures for entering the courthouse starting Monday. These will be for a 2-week period through May 29th and include a mandate that masks will now be required to enter the building, and entrances will be restricted depending on your destination. The Denver entrance, or the east side of the courthouse, will be used solely for county employees and those with county-related businesses. Now, while the plaza entrance, that's the north side of the courthouse with the library just across the way, it will be used solely for court participants. Every effort will be made to direct those who enter the building to use the escalators as much as possible and to encourage social distancing on elevators and throughout the building. Next, our Director of Court Services has put out a plan for handling pre-trial release clients and community service workers. Our community service crew chiefs have continued, I'm so grateful for this, to work throughout the county to clean up sites on their own until it's safe for crews to come back online and help them. And lastly, urine analysis testing will not resume until June. So if you have business to conduct at court services, you will be provided protective gear before you enter their office. And you're encouraged to call them at 918-596-5795. That's 596-5795 if you have any questions. Now, Presiding District Judge Bill LaFortune began working early to figure out how to keep our court system running while keeping staff and clients safe. And he's going to join me now to talk about how he's going to roll out the court system on Monday. So we're going to do a little social distancing practice here. I'm just going to put this up. Okay, if you'll come in. Thank you.
Good afternoon. Thank you, Commissioner Keith. First, I would like to thank the entire Board of County Commissioners for putting in place a number of protective measures for the initial reopening of the courts on May 18th, next Monday. I am thankful that they are following the advice of Dr. Dart by requiring masks for all those who enter the courthouse during these first 2 weeks and limiting access to persons who only have specific business with the court. Other persons who are not necessary to a specific court proceeding or who do not have specific business with the court or court clerk or county department will not be granted access to the courthouse during these first 2 weeks that the courts are open. So those that do not have necessary and specific court business should not come to the courthouse. And those that do should enter the courthouse and exit the courthouse as soon as they complete their business here in the courthouse. The message simply is during these first 2 weeks that the message is do not come to the courthouse over the next 2 weeks unless you personally have specific business with the court, again, the court clerk or the county or a county department. Now, Monday, in my capacity as presiding judge, I issued an administrative order which covered the first 2 weeks of the reopening of the courts, May 18th, next Monday, to May 29th. This is phase one as far as the court's reopening plan. Now, the order provides a specific plan for each division of the court, We have 5 or 6 divisions. The primary goal, though, of the general order, the administrative order, is in phase 1 simply to reduce as much as is possible the number of people coming into the courthouse during these first 2 weeks. While the court and its divisions get their feet back under them, that is the purpose. Now, the order takes the court's heaviest dockets and puts in place several relief valves to reduce the numbers of people coming into the courthouse. Specifically, those criminal defendants who are out of custody on bond do not need to appear and should not come to the courthouse during these first 2 weeks. This includes initial appearances, misdemeanors, preliminary hearing, and district court arraignment and traffic dockets. During these first 2 weeks, the court will focus solely on in-custody criminal defendants and addressing that backlog. However, no in-custody defendant will be brought from the jail to the courthouse unless a specific defendant is ordered to be brought to the courthouse by a specific judge during that 2-week period. All of these cases for out-of-custody criminal defendants will be passed to a date after June 1st, and those defendants will need to go to the Oklahoma Supreme Court Network, or OSCN as it's known, website, and they'll get their new dates on the minute for their case from that website. Or, of course, they can inquire of their attorney, as most will be represented by attorneys, in order to obtain their next court date. Now, our other heaviest docket, the forcible entry and detainer or eviction docket is also known, and our small claims dockets, extremely heavy dockets. We have addressed those in this initial phase 1, 2 weeks. All of the cases set on those dockets during phase 1 will be passed to dates after June 1st. So, quite simply, to the public, do not come to the courthouse during the first 2 weeks of the court's reopening, May 18th to May 29th, if you have an eviction case, small claims case, an asset hearing, or exemption hearing. Those persons with those cases will be reset, and the new dates will again be available online through OSCN, or if you're represented by counsel, through your attorney. However, many people are not represented by counsel, so they need to go to the website to get the new dates. The reason for resetting all of these cases on that small claims and eviction docket is to reset them in a manner which we still have under consideration, which will lessen those huge numbers of people coming into the courthouse at one time, and also to comply with the CARES Act. The CARES Act has specific provisions protecting tenants through July 31st. And so there will have to be a lot of cases reset. There's certain forms that have to be filed by the parties also pursuant to the CARES Act. And we're very, very cognizant and understand our responsibilities in terms of that act and the protections it provides for tenants. Now, if you have a case in another division, probate, civil, juvenile, or family divisions, please consult my order. There's a specific plan for each division, and it'll tell you exactly how things will work in those divisions over this 2-week period. But please be aware that except for really emergencies, most cases in those divisions, in fact, all divisions, will not involve in-person hearings, again, outside of emergencies. Many cases may be handled remotely by agreement of the parties through video or telephonic conferencing. My order also includes restrictions as to courtroom access that were put in place by the Oklahoma Supreme Court, i.e., number 1, no public access to courtrooms unless granted by the specific judge, and if access is granted, masks and gloves are required to enter the courtroom. Again, per the Oklahoma Supreme Court, no more than 10 people, including the judge and staff, in a courtroom at any one time. That can be increased to 50, and with some of the things the mayor said about going up to 50 here in the city, We'll take that in consideration, and I'll confer with the Oklahoma Supreme Court if we're allowed to do that. But for now, it's 10 people in the courtroom at any one time. And the Oklahoma Supreme Court, of course, mandated social distancing within each courtroom. And we'll have markings in courtrooms for that to ensure that. My order also restricts access to judges' chambers and office areas. Courts will have in-out boxes for orders to be left for signature, orders that have been signed. Those will be outside the doors of each judge's chambers. And there will be in and out boxes for each judge on the second floor. Lastly, jury trials, which were set for May 18th, June 1st, and June 15th, are canceled. In fact, no juror summons were even issued for those dates. So no one should be coming down to the courthouse for jury duty during those weeks. Now, all of these protocols are only in effect for the first 2 weeks of the court's reopening, which we call phase 1 here, as far as the court's reopening. There'll be a phase 2 and a phase 3. And I have a group of senior judges working with me on those phases, and those will be announced shortly in the next week, probably. Now, those protocols, though, there is no statewide plan. There is no statewide plan for our district courts to follow. The local courts are putting together their own individual plans with the Oklahoma Supreme Court and in conjunction with the county commissioners in their districts. All of us involved in the operation of the courts are doing what we believe is necessary to protect the public and the employees. And with that, that would conclude my comments.
Thank you, Judge LaFortune. Please stand by as we bring our speakers back for questions.
Our first question is from Fox 23 for Dr. Dart. Is there a vaccine or proven treatment for COVID-19? If there is a vaccine or proven treatment for COVID-19 that comes out in the near future, how long would a city like Tulsa have to wait to actually see any of that medicine get here? Are we talking a matter of weeks, months, or even years?
You know, that's a really good question, and all we can do is speculate. You know, back in 2009-10, when H1N1, with our last pandemic, was here, we were part of a team that went to the White House and created a vaccine strategy, and we're hearing that same type of effort will take place. Once that vaccine strategy was created and vaccine was available, it's actually in communities in weeks. So we're hoping that this follows a similar process, but frankly, we don't know. And we're really right in the middle of that vaccine creation process. So, so we've asked through our national organizations to start these conversations and start this planning so that when it is available, it becomes available as quickly as possible to local communities.
Okay. For Dr. Dart from KRMG, our understanding is that people who travel to Oklahoma from certain cities are still required to self-isolate for 14 days after arriving here. Does that remain in place during phase 2?
You know, I'll have to, actually, we have a call into the governor's office as we speak to see if that's a recommendation that's going to follow through phase 2, knowing that every place is a hotspot literally now, and it's everywhere. And so we really don't know if that recommendation still needs to be here. Hopefully we'll get some guidance from them and we can forward that to you when we get it.
Okay. Tulsa World for Dr. Dart. Can you clarify what downward trends the county has met to enter into phase 2 reopening, new cases, hospitalizations?
So, as I said earlier, we use a rolling average because if we just looked at pure numbers, a graph would look like this. It spiked up and down. But when we take these rolling averages, what we do is that we average these case numbers over the course of several days, in this case, 4 days, 7 days, and we get a trend line. So it allows us to determine if those peaks and valleys actually mean something. And if we can do that, it lets us know where our numbers are actually going. So we average it, we trend it, and like last week, we were even though the cases weren't that high, because we were averaging, the trend was still going upwards. But now we're averaging over time, trend is going downwards. Now, is it significant? I mean, it was only a slight trend upwards last week, flattened over the weekend, and now it's a slight trend downward. So any movement is, from a statistical perspective, it's a positive thing. It lets us know what's happening in the community, and that's what we'll continue to follow. And trending it like that will let us know if there's some kind of significant event that we need to be aware of and track.
Okay. Fox 23 for Mayor Byam. The U.S. House is considering a $3 trillion spending bill that includes assistance for municipal governments. Does Tulsa want or need any additional federal funds at this time?
I've visited with a few members of our delegation about that, but I don't know enough about the details of that legislation or where it stands or what's proposed to make an informed comment on it.
Okay. Fox 23 for Mayor Bynum. As someone who has been on the front lines of making policy during this pandemic, while also having children in TPS, do you think children will be able to go back to the classroom in the fall for in-person learning?
I think one thing we've learned throughout this pandemic is that it is dangerous to try and predict what things are going to be like a month from now, let alone 3 months from now. So as I said earlier, I think that it's important that we continue to just monitor things week by week and see how we're doing. One thing I do know, though, as a parent of a TPS kid, is that Dr. Gist and her team will not allow school to go back if it's not safe for those kids. And so I have complete confidence in them and their judgment as it relates to the safety of kids in TPS. But, there's no way to know today what things are going to look like in early August in Tulsa. And so we'll just continue to put one foot in front of the other and see where it goes.
Okay, Mayor Bynum from KTUL. After tomorrow, basically everything will be back up and running with restrictions. Are you concerned that it will have an impact on virus cases moving forward?
Well, we know, based on everything that I've been told by both our local public health experts, but also on a national level, that when you reduce social distancing restrictions and you have more people out and about, you're going to see an increase in cases. Whether that was May 1st or December 1st, you would see an increase in cases just because you have more people coming into contact with one another. The real question is whether or not your local healthcare infrastructure has the ability to handle that increase. That's why we're proceeding with caution through these different phases and identifying what different reductions and restrictions, what kind of impact that has on an increase in cases and an increase in hospitalizations. And that's why I'm so pleased with the data that we're seeing so far. It shows that Tulsans are being diligent and careful as we move forward. But again, we'll just continue to be very gradual and identify what things are working and what things present challenges. We're in a brand new era here that we as a city and we as a state and a country have never had to navigate before in identifying how to minimize the spread of a virus while allowing people to go about our day-to-day lives as close to normal as we can get.
Okay. Dr. Dart, are tests available for those without symptoms, antigen tests or PCR tests?
We've actually expanded our guidelines, and as you know, originally we were really focused on those who've been exposed, who are having symptoms. But now, if you come to the Tulsa Health Department, we will test anyone who comes here. I think when we talk about antibody testing, the jury's still out on the reliability of all those tests. Although we know that those testing processes are getting better. But if you want to test, call us, Tulsa Health Department. We will ensure that you get one.
Okay, Mayor Bynum from Channel 2. Will undercover or uniformed officers be in bars and clubs looking for COVID-19 related violations? Will there be additional patrols on Friday or over the weekend? And what are the penalties for bars and patrons if they are caught violating the order?
So the Tulsa Police Department has worked very closely with the Tulsa Health Department to monitor violations over the last 2 weeks, and we would just continue that same process moving forward, as it is with most of the cases that the police department pursues. We're relying on people to let us know if they see something that looks out of line. In the cases that we have responded to so far, that I'm aware of, those came from citizens recognizing that they were at a business that wasn't practicing safely and let us know. And then we worked with the Tulsa Health Department to reach out to those businesses and make sure that they knew what they needed to do. As we ramp down, it's similar to when we were ramping up. Our goal, first and foremost, is to make sure that businesses know what they need to be doing to protect their employees and their customers. And by and large, the vast majority of businesses are doing that. In a few cases, you have folks who either don't know or weren't going to bother to, and we've had to reach out and let them know. But we're not sending the cops out to try and trick people and give them citations. That's not our goal. Our goal is to make sure that people know what they need to do to keep their customers and their employees safe.
Okay. Fox 23 for Judge LaFortune. With there being so many cases being backlogged, including jury trials, is anyone who received a jury summons back in March, but then had their duty canceled, going to be recalled in the near future to serve again, or does my name simply go back into the pool?
Second.
You're good. You're good.
Good?
Yeah.
All right, proper social distancing. There are 3 weeks, I didn't address this, that we may add jury trials in August. There's this Oklahoma Supreme Court basically was driving the vehicle in terms of canceling these jury dockets. And so we had a fall schedule that doesn't start until August 31st. And so we may be able to add, if authorized by the Supreme Court, 3 weeks or less, 1, 2, or 3 weeks, the first 3 weeks of August. If we do, it'll be only for in custody defendants to get that backlog taken care of, criminal cases, and I'll probably assign civil judges over for those 2 or 3 weeks to handle those cases. Now, for juror summons, again, they should not have received any summons for the 3 weeks that I just announced the cancellation of. If they received juror summons before that, for any prior dates, then yes, they would not have to worry about any further jury service if they were excused because of prior cancellations. And remember, we lost 7 jury trial weeks starting at the end of March. So the total is 7 if we include the June dates that I just announced. So anybody that received them for those dates prior to May 18th, that would have been 4 jury weeks. Anyone that received them and did not come to the courthouse because they were canceled will not have to worry about coming back for further service unless they receive another jury summons.
Okay. Our last question is for Dr. Dart from KRMG. New guidelines allow groups up to 50 instead of 10. Presumably, social distancing will still be recommended. What about masks for funerals or weddings?
We would, it's not required, but we would still recommend anytime you're out in public at any type of public event outside your home, wear a mask. I mean, the virus is still here. And even though as we go through these phases and these reopenings, we have to remember that there's still danger out there. So what we can do to protect ourselves, and wearing a mask in public is really one of the best things you can do. I would recommend that at these formal events, weddings, funerals, to continue doing that, continue wearing a mask, and keep yourself safe and those around you safe as well.
Okay. And at this time, that concludes our press conference. Thank you very much.